Hi, everybody. I'm sitting here with Dr. Antosz and Dr. Vincelli, and we're doing a quick Q&A today. So, Dr. Antosz, can you tell me a little bit more about how too early is? I found that really interesting. When should I bring my child in for an assessment?
Well, quite honestly, in general, there's no such thing as too early, because there's three potential outcomes of an exam. One is that the orthodontist will identify problems that need to be treated immediately, which is great. We may find problems that are going to be treated at some point in the future, and that's great because then we can prepare families and parents for what's coming up in the future. And the third possibility is we're going to say, everything's looking okay, there's no problems, get back to us if you see anything that bothers you. So there's no downside. Now, in general, we like to see kids around the age of 8 years or so, 7 to 8. At that age, our business is understanding how kids grow and what direction they're heading, and we can identify problems at that point and give parents a general direction of where they're going in the future. Now, sometimes there's things we'll want to see even earlier than that. And if you ever hear the words crossbite or underbite, or there's breathing issues during sleep, then we'll want to see them earlier, and sometimes as early as age 3 in particular circumstances. But for the general population, if we see kids around 7 or 8, we know where they're heading, we know how they're growing, and we can tell you their orthodontic condition and what they may need now or in the future.
Right. And I was taught always, like, you don't go to the orthodontist until you're a teenager. And now we're finding out, and it's been for years, that the experts know that you have to come earlier to prevent more problems in the future.
There are problems that teens have that are much easier to treat when the children are younger. And in fact, there are some problems that cannot be treated once they hit the teenage years. It's too late. So, like I said at the beginning, there's no such thing as too early. And the worst possible outcome is we may say, well, there's no problem. So that's always nice.
Right. Thank you. And Dr. Vincelli, we talked about adults and jaw pain. So there's a lot of adults who suffer with jaw pain for long periods of time, and they don't know that they can get some good treatments and good results from coming to see you.
Yeah, jaw pain, it's very common, and it's sometimes maybe not really realize that it's jaw pain. People think it might be something else because the symptoms can be really different for different individuals. So some people have a lot of headaches. Some people have even ear symptoms like fullness in the ear, ringing in the ears, things like that. And then obviously the classic jaw pain. But a lot of times they don't know exactly what's going on, and they go see different specialists and they try and get this problem resolved. But it basically comes down to the teeth not fitting together properly with the jaw in the right place. So the jaw has to kind of adjust itself, and the muscles are overworked, and that's what leads to all these issues. So, it's pretty simple, the treatment that we do, but it takes kind of proper diagnosis and catching it when it cannot be. I'm trying to say it's not really that obvious sometimes. Like some patients don't even have symptoms, but we see that they're wearing down their teeth and they have lots of recession or breaking down of the teeth. So basically it involves a splint, the treatment, and the splint, it's basically mimicking like a perfect bite. And when the patient bites down on the splint, all the teeth fit nice and evenly, and then the muscles start to relax. And as the muscles relax, the jaw goes back into its socket, and then the splint doesn't fit anymore. So they have to come back usually every month or so, and we do adjustments on the splint until they're feeling better. And for us, it's nice because we have to get patients out of pain, but also for us, it actually we use it as a therapeutic diagnosis as well. So the splint kind of reveals the true bite problem. So depending on how much the jaw changes afterwards, will actually tell us what kind of treatment the patient needs afterwards to then, permanently fix their bite and get them out of that splint. So. it's very rewarding for both of us.
That's really interesting because I think a lot of adults think, oh, if I have jaw problems, the only solution is braces because that's all we hear is braces. So there's a series of treatments and each one is going to have its own solution and there's many solutions.
That's right. Exactly.
Yeah.
And so it all depends on how much the jaw changes after the splint treatment. A lot of times we like to use aligners after the splint treatment. Just because of the way that the jaw repositions, aligners, we have a little bit more control in how we move the teeth. So, a lot of times patients are worried to start because they don't want to have braces when they're adults.
Yeah.
But we actually say, no, we actually prefer aligners to treat afterwards. So, it all kind of depends on how the patient reacts.
Awesome. Thank you. Thanks. And that's it for today. See you guys all next month.